Welcome to the Humble Hoof Podcast. My name is Alicia Harlov. This is a podcast for both horse owners and hoof care professionals, offering discussions into various philosophies on the health of the hoof and soundness of your horse. Please check us out on Facebook or at thehumblehoof.com. A special thank you to our wonderful sponsor, Cavallo. For our Humble Hoof listeners, they are offering 15% off their Cavallo Trek hoof boots using the coupon code HRN at checkout. The Trek is the world's most popular and versatile hoof boot and Cavallo's toughest trail boot, while also doubling as an option for therapy or rehab. The front closure system makes it easily adaptable to various hoof shapes, and TPU upper design allows for maximum strength while minimizing weight for the comfort and ease of movement for your horse. These are recommended by vets and trainers and also loved as transport boots by barrel racers, show jumpers, dressage riders, and everyone in between. Again, for 15% off a pair of Treks, use the code HRN at checkout at cavallo-inc.com. Most people involved in any kind of equine soundness or lameness rehab have probably heard of Dr. Sue Dyson. Dr. Dyson has been researching lameness and been involved in equine orthopedics for years, and she has something like over 450 peer-reviewed papers on lameness and diagnostic imaging. Something that I've been really interested in is Dr. Dyson's Ridden Horse Pain Ethogram, which is a list of 24 behaviors that horses exhibit when they might be in pain. And unfortunately, they're behaviors that we can commonly see in horses. I reached out to Dr. Dyson so I could talk to her about how we can tell if our horse is potentially in pain and what we can do to advocate for these animals who do so much for us. Can you start by telling us a little bit about your journey into equine lameness research and how you got to where you are today?
Yes, I became an equine veterinarian because I was a rider. And I had recognized as being a rider that the most frequent cause of horses being out of work was because of lameness. So it was kind of a natural progression to draw me into lameness investigation and poor performance. And I'm always a curious person. I don't just accept the status quo. So as a clinician, I was always asking more questions and trying to find out more. And sometimes being successful and sometimes not being successful.
Yeah, and I, reached out to you because of your work in equine lameness and because of the pain ethogram that you developed. So could you give us a brief overview of the Ridden Horse Pain Ethogram?
Yes. Well, first of all, I'm going to describe to you why we wanted to develop the Ridden Horse Pain Ethogram, because it was clear to me over many years that owners and trainers and even veterinarians were relatively poor at recognizing lameness, especially if it was present in more than one limb. And therefore, we were being presented with horses for investigation, which had had problems for some considerable time. And as a result of that, they had also developed secondary issues as well. And the longer a problem has been present and the more problems that there are, the more difficult they are to successfully manage in the long term. So it seemed to me that we needed an additional tool that would be user-friendly for riders, trainers, veterinarians, and any other type of paraprofessional to facilitate the identification of pain. And work has been done in other species and in standing horses to show that facial expressions can be used to determine the presence of pain. And obviously, with ridden horses, we have got other potential markers that we can use as well. So in collaboration with a lady called Dr. Janine Berger, who is a German-based veterinarian in the United States who's double-boarded in veterinary welfare and veterinary behavior, we developed the ethogram. Now, an ethogram is a series of behaviors, each of which has specific definitions. So, for example, the head being in front of a vertical position more than 30 degrees for more than 10 seconds. And in order to develop the ethogram, the Ridden Horse Pain Ethogram, we looked at multiple video recordings of lame and non-lame horses and came up with a list of 117 behaviors that we were observing quite often in lame horses, and we thought more commonly in lame horses than in non-lame horses. We then applied this rather unwieldy 117 behavior ethogram to a series of non-lame horses and lame horses. And the non-lame horses were in regular work. They appeared non-lame in hand, no response to flexion tests, no evidence of lameness on the lunge on either soft or firm surfaces, and worked happily during their full repertoire of movements when ridden. So they underwent a fairly stringent test. And we were able to determine that when this 117 behavior ethogram was applied to the lame and the non-lame horses, there were behaviors that were more likely to be seen in lame than non-lame horses. And the 24 behaviors that comprise the Ridden Horse Pain Ethogram, the majority of these are at least 10 times more likely to be seen in lame horses versus non-lame horses. Now, it's important to recognize that each of the individual 24 behaviors could potentially have a variety of different causes. So, for example, a horse may repeatedly swish its tail because it is being irritated by the rider continually applying a spur cue. So when we're deciding whether or not a horse has underlying musculoskeletal discomfort, we have to have a cutoff value of the number of behaviors. And we have been able to demonstrate in a number of different studies that a total score of 8 or more out of the 24 is the threshold for the very high likelihood of the presence of musculoskeletal pain. There is a minority of lame horses which score less than 8. I have never seen a horse which was not experiencing discomfort that scored 8 or more. So 8 is the magic number, and 8 or more indicates that it is very probable that the horse has musculoskeletal pain. It doesn't tell us anything about where the pain is coming from. It just is an indicator to us that this horse needs investigation to determine the source or the sources of pain.
Yeah, and I know as a hoof care provider that the more I started to learn about and realize different indicators of lameness and different indicators of hoof issues, the more I saw them everywhere. So is this something where that developing this, has that changed your perspective on horse behavior over the years?
I think I've been a very close observer of horses because I've owned my own horses. And although some of the time they've been at part livery, I've been the person that's fed the horse. I've mucked out the stall. I've tacked it up. I've observed its behavior during all these exercises, and I've observed the behavior when ridden. And I've owned horses which have had problems, and I had recognized that when horses were uncomfortable, they tended to change their behavior. And over the years, I have observed that in a large number of clinical patients. So I was absolutely convinced before we started the research that our hypotheses would be proven, that there would be a set of behaviors that would indicate to us that the horse was experiencing musculoskeletal pain. So the results were not a surprise to me at all, but they were a way of being able to tell people that this was a tool that could be utilized, and it was designed to be utilized by any person who learned how to use it. Like any tool, you have to learn how to use it, and with practice, you get better at using it. You have to know what the definitions of each of the 24 behaviors are. But once you have mastered that, it can be used as an accurate tool by anybody. And everybody says to me who's learned how to use it that once they've opened their eyes and looked and seen what is out there, they can't unlook. That is, they were probably before unaware of how many uncomfortable horses there were, and now they are much more aware.
Yeah, and I know that there are so many people that will sometimes blame these behaviors on either like a training problem or the individual's horse's personality. But are you saying that really that 8 number is kind of what we're looking for to make sure that it's not just a training issue or a behavior issue?
Absolutely. I think you have to realize that many of us learnt to ride at riding schools. And a variety of studies in European countries have demonstrated that a large proportion of riding school horses are experiencing some low-grade discomfort. And therefore, they exhibit these behaviors. So we have been brought up in a riding environment to accept these behaviors as being normal for horses. So I remember that the riding school that I went to, Robert always had his ears back. Bruno was a lazy horse and he used to swish his tail and had to be kicked repeatedly. And this was just accepted as normal. But in fact, it is not normal. Now, some of these behaviors could be a reflection of training, but I do not believe that a training problem, unless there is underlying musculoskeletal pain, will cause 8 or more of these 24 behaviors. So we can use this to differentiate between a training-related problem and a primary pain problem. And you have to bear in mind that, for example, if you took a dressage horse that was stepping up such that it now had to do half pass and travers, it may have been living with its discomfort previously, but now it's being asked to do something which is biomechanically more demanding. It then begins to manifest as discomfort because that discomfort is magnified when the horse is asked to do something which is biomechanically more difficult for it to do. So historically, because the horse was showing abnormal behaviors, it was listed as a training-related problem, whereas in fact, it's more likely to be a pain-related problem. Now, that's not to say when you introduce a new movement, every horse is going to learn with equal facility. Some horses are going to find it physically more difficult, and some are quicker learners than others. But I would expect in a pain-free horse that if you're training it correctly, over the next 7 to 10 days, the horse should progressively be improving, assuming it doesn't have underlying discomfort.
Yeah, that makes sense. Now, as Dr. Dyson and I are talking about these behaviors on the Ridden Horse Pain Ethogram, she really wanted to make sure that listeners understand that this isn't always a discouraging thing that's used to just find all of these lame and uncomfortable horses. Even though Dr. Dyson mentions that horses that have more than 8 of these behaviors, that it's likely the horse has a lameness or discomfort. The other positive side of that is that it can be used to affirm that your horse might actually be okay. So if a horse has less than 3 out of these 24 behaviors, then it's highly unlikely that there is any underlying discomfort, and that can be really reassuring. On the other side of things, say you're doing a pre-purchase exam and you are looking at a horse that has more than 8 of these behaviors, it might be a wise decision to walk away from that purchase. And so for people who are just for the first time hearing about some of these behaviors being related to pain, I know that you mentioned, having their head ahead of the vertical and swishing the tail and being lazy under saddle or seemingly needing to be, kicked on a lot. Can you give some more examples of behaviors that might be misinterpreted or missed by owners or professionals?
Yes, the head moving up and down repeatedly, not in rhythm with the trot, because if it was in rhythm with the trot, it would be likely to be a reflection of fall and lameness. So it's out of rhythm with the trot. Or the horse moving its head from side to side on an irregular basis, or the horse repeatedly tilting its head so that the pole is down on one side and its nose is pointing in the opposite direction. We've talked about the head being in front of the vertical. We also have one of the behaviors as the head being behind a vertical position for more than 10 seconds for 10 degrees or more. The ears being repeatedly laid back for 5 seconds or more. The eyelids being closed for between 2 and 5 seconds. The sclera or the white of the eye being exposed repeatedly, assuming that at rest, you cannot see the white of the eye. There are some horses, such as paint horses or some palominos, when you can see the white of the eye at rest. And if you can do that, then you can't use that behavior. The horse opening its mouth repeatedly with separation of the teeth for 10 seconds or more. The tongue either lolling out of the mouth on a continuous basis or moving in and out. The bit being pulled through to one side of the horse's mouth. The tail being either held crookedly to one side or clamped to the midline so it doesn't swing as it should do. The tail being repeatedly swished. The horse either rushing or having an irregular speed, or the gait being too slow, which is characterized by a frequency of trot steps of less than 35 steps per 15 seconds. The horse moving crookedly so that the hind limbs don't follow the tracks of the forelimbs. The horse, when performing a transition from trot to canter, making repeated errors, or the horse becoming disunited or cross-cantering behind. If the horse breaks spontaneously from one gait to another, for example, it breaks from canter to trot without the owner asking it to, or the horse having either a repeated hind limb toe drag of both hind limbs or stumbling or tripping. And then the horse suddenly changing direction against the rider's cues. So, for example, you might be on the right rein and you're going down the long side of an arena, and then the horse suddenly veers to the right when the rider didn't ask it to. And then the horse being reluctant to go forwards, having to be kicked repeatedly, or stopping spontaneously. And finally, the horse either rearing or bucking.
Yeah, and some of these are fairly subtle in the sense of, I think that a lot of us have either ridden a horse that has exhibited something like that or seen horses ridden like that have exhibited these behaviors. So it's, it doesn't have to be as dramatic as I think many of us assume when we're thinking of a lame or uncomfortable horse. So, as an equine professional, I'm a hoof care provider myself, but are there some practical ways that we as equine professionals can incorporate this ethogram in our everyday work with horse owners?
Absolutely. I mean, I think I would recommend that every horse is evaluated on a regular basis so that we can pick up signs of discomfort early on, because then we're more likely to be able to manage them. There is a pictorial guide available through the 24horsebehaviors.org website, and there's a downloadable app as well, which gives brief descriptions, not the full descriptions, but also on the website are the full descriptions of these behaviors. There's also, for people who want to delve a bit more deeply, particularly for professionals, there's a course which is hosted by an American-based charity called Equitopia. So if you just Google Equitopia, you can find out all about it. There's a documentary film, The 24 Behaviors of the Ridden Horse in Pain, Shifting the Paradigm of How We See Lameness. That's available free to view on YouTube, which tells the story, actually, of a show jumper, which was the trainer kept blaming the rider for the horse's failure of performance, whereas the rider was convinced there must be an underlying problem. And we indeed demonstrated that there were underlying problems. So that's a story woven around education about the ethogram. And then there's also a book called Harmonious Horsemanship, Use of the Ridden Horse Ethogram to Optimize Potential Partnership and Performance, which goes into case histories and describes riders' experiences of their frustrations in their dealings with veterinarians when veterinarians haven't seen their horses ridden, although they've been convinced that there was something wrong when the horses were ridden. So then they've been able to go to their veterinarian and say, well, look, my horse has scored 9 out of 24. It must be uncomfortable. Please, will you see the horse ridden? And then please, will you investigate this horse further to try and find out what the underlying problem is?
Yeah, and I was actually going to ask that question next about what to do with your veterinarian, because I did watch that documentary about the horse Galena. That's the one that you were talking about, right?
That's right.
Yeah. And it was, obviously that was great that you were able to go out in person and have all of this knowledge of what to look for in the horse and be able to do the nerve blocks and diagnostics to sort of pinpoint what was going on. But obviously you're not in every country or every area, and maybe there are some places where people don't have the same access to veterinarians who are familiar with that. So do you suggest just familiarizing yourself with the pain ethogram and then having a conversation with the veterinarian?
Yes. And I think that if your veterinarian is just a general equine practitioner, they may not have the skills to properly investigate. And they may do things like suggest, well, if the problems are only evident when it's ridden, maybe if the horse has got a back problem, let's x-ray the back. And then they might find several close spinous processes and then conclude that the horse has got so-called kissing spines. And that's all potentially misleading because lots of normal horses have spinous processes that are close together. And I think that in order to investigate these types of problems, we have to be using nerve blocks to determine the source or sources of pain. And then having established the sources of pain, then go ahead to use diagnostic imaging, being X-rays or ultrasound, or if necessary, CT or MRI, in order to determine what is the cause of the pain. Now, if you were a human athlete, you wouldn't go to your local MD for a diagnosis of your problem that you experienced after you'd run 500 meters. You would go to a sports medicine specialist of some sort. And I think the same should apply to horses, that you can't expect every equine veterinarian to be fully versed in all aspects of equine veterinary medicine because it's a vast field. So you need to be taking the horse to somebody who does have the necessary expertise to investigate further. And people say, well, surely that's terribly expensive. Well, actually, the time taken to perform nerve blocks is not that long and it's not that expensive. But if you were to go on a fishing imaging exercise, so for example, the horse was to undergo full body scintigraphy, followed by umpteen x-rays, that would be expensive. And I don't think that's likely to get you to the right answer. So I would be a really strong advocate that the horse has got to be investigated by somebody who is prepared to use nerve blocks and evaluate the horse ridden both before and after the nerve blocks. And only when you as a rider are satisfied that the horse is moving happily and willingly, and this ridden horse pain ethogram scores have come down substantially, should you think that you've got to identify the sources of pain.
Yeah. And so really it's in the horse's and the owner's best interest to be really familiar with the ethogram and then be able to, advocate for the horse in that way. And I am glad that you shared the resources earlier because I've spent some time looking at them and it's so easy to access and it's easy to, identify these issues once you're plainly showing them in your resources. So thank you for sharing those.
Yes, I mean, I don't think anybody should feel intimidated. It is a tool that is well within the capabilities of anyone to use. Now, people tend to get a little bit worried and sometimes they overinterpret things, sometimes they underinterpret, but they generally get the right ballpark figure. We took, in one particular study, a group of 10 people who had had no experience in application of the ethogram, and they were asked to view the video recordings of what they thought were 42 different horses. What they actually saw was 21 horses presented to them in a random order, both before and after the use of nerve blocks. And some of the horses were presented after nerve blocks first, and then subsequently before nerve blocks, and other horses were presented the other way around. And these non-trained people were able to differentiate between the horses which were experiencing discomfort and those that were not, just using the Ridden Horse Pain Ethogram. So that demonstrated that non-trained assessors could utilize the tool and they could do it with pretty good agreement with a trained assessor.
And learning all this, I'm very much not in the competition world. I've never really been into competition, but I did just recently go down to Florida and spent some time watching some shows. And I do wonder, do you have any thoughts on these pain behaviors in competition horses and sport horse welfare? Because once you start recognizing these behaviors, it's hard to miss how commonplace they can be in equine athletes. So do you think that there is maybe a risk of drawing negative attention to horse sports in general, or how can we better advocate for these athletes? Do you have any thoughts on that?
Well, I feel very strongly that we need to be advocating for the athletes because it is within our power only to improve the welfare of sports horses. And this is a hot topic around the world at the moment. And I think it's very important that we advocate for the horse. I was in Ocala in December. I was at the World Equestrian Centre, and I saw exactly what you're describing. I saw a lot of uncomfortable horses. And I know that those horses are kept going by the trainer. The trainer says, well, we just need to medicate its coffin joints and its hop joints and its stifle joints on a regular basis. And that's it. I don't personally follow that path. I feel that we need to know where the problems are and treat the horses accordingly. I'm not suggesting that we stop riding any lame horse. What I'm suggesting is that we identify those lame horses and identify definitively their sources of pain, and then we target the treatment appropriately for what the sources of pain are. And only when we've identified the sources of pain can we really treat in an educated fashion. And sometimes the horse is going to have some time off. And that's not a very popular thing, particularly with trainers and owners. But we have to be realistic. And I think we have to be, as I said, advocating for the horse.
Right. And I do think, if we're really viewing these animals as athletes too, that it's in the best interest of a long-term athletic career to be doing what you're saying and really looking for the source of the pain and rehabbing instead of just kind of throwing NSAIDs or medication at it.
Yes, very much so, because I think that there is a culture, and that culture is worldwide, but I think my observations are it's particularly prevalent in the show horse world in the USA, of accepting that all horses undergo routine medication, which is ridiculous. They shouldn't need medication if they haven't got a problem. And if they have got a problem, we need to be identifying what that problem is and treating it to the best of our ability to preserve the longevity of the horse's career.
Absolutely.
And that means a holistic approach to the horse. So it means that the veterinarian has to work with the tack fitters, they have to work with the podiatrists on the barrier, they have to work with the dental technicians. So it's a team effort. And also the rider has to take some responsibility. They've got to be appropriate in their position in the saddle and in their application of the cues. So it is a very much, I believe, a holistic approach to the whole horse and everything that goes on with that horse.
Right. And it almost sounds like it almost has to be sort of a grassroots start of the people that are working with these horses, advocating for the horses, as we're seeing these behaviors. Because ultimately, it's like, as you said, it is kind of ignored at times, or if people are unaware of the behaviors themselves. But if we're working with these horses every day, then kind of pointing out and advocating for the horses where we need to start.
Yes, I think so. I mean, it's just like you as a hoof care specialist, you notice that Fred, who normally picks up his hind limbs really easily, this time appears to be uncomfortable. You're going to say something to the owner, I hope, and say, something's off with Fred. And the sooner we investigate further, the better, because these changes in behavior, albeit subtle, are important indicators that something is not right. Equally, if the horse used to stand to be mounted and now rushes forward as soon as you try to get on, that's not normal. Something is triggering that. The horse that used to stand still whilst it was girthed and now is turning its head to the girth and trying to bite you, or picking up a hind leg or swishing its tail, That's a change in behavior that indicates that something is not right. And there has been a tendency among the riders and amongst the veterinary profession as well to suggest that these behaviors are perhaps the result of gastric ulceration. So the horses undergo gastroscopy, and often ulcers are identified. And then the horses undergo expensive treatment with omeprazole. Although you get short-term improvement, there is not long-term improvement, because in actual fact, these ulcers are secondary to the presence of musculoskeletal pain often. And that's the kind of change of mindset that needs to take place. And I'm not alone in saying that. One of the world's experts in gastric ulceration or the gastric ulcer syndrome is Dr. Ben Sykes from Australia. And he has recently written a commentary that's been published saying that the number one reason for changes in behavior is musculoskeletal pain. Number two is the presence of ulcers. And number three are dental problems.
Wow. And that's so interesting, because I do think when in that documentary about Galena, they started with treating for ulcers and there was initial improvement, but then went back to having the same issues as before.
Yes, I think it's reasonable to assume that the ulcers themselves may, in some horses, create some discomfort. And there was a recently published study in Belgium when they were looking at show jumpers. And although they were performing adequately, they weren't performing optimally. And they used the Ridden Horse Pain Ethogram as a way of monitoring their behavior. And these horses underwent dietary change alone. And with dietary change alone, over a period of weeks, the ulcers improved, as did the horse's ridden behavior. Wow. So I'm not saying that gastric ulcers cannot induce some abnormal behaviors. I think they can, but we always have to be thinking, why have the ulcers developed? In the Belgian study, it was because they had an inappropriate diet. But often it is related to underlying stress, and that stress is often musculoskeletal pain, which may be compounded by the management practices, the failure to have adequate turnout, the failure to allow adequate social interaction with other horses. So it can be multifactorial, but musculoskeletal pain is the number one problem that needs to be addressed.
Absolutely. And before I ask, any last minute advice that you have, is there anything that we didn't address that you wanted to touch more on that you feel didn't get enough attention?
I think that many owners say, well, if the horse is ridden better, won't that eliminate these behaviors? And we did a study when we looked at 40 horses that were ridden by the normal rider and a single professional rider. And they all performed an 8.5 minute duration dressage type test. And in 50% of the horses, they were ridden first by the normal rider and then the professional rider. And in 50%, they were ridden first by the professional rider and then by the normal rider. And independently, the rider's skill was given a score of 1 to 10, like a dressage judge does. And the quality of the gaits was also ascribed a score of 1 to 10. And the Ridden Horse Pain Ethogram was applied with each rider. And although the horses were in regular work and the owners thought that they were working comfortably, not surprisingly, some of them were uncomfortable. They were lame. And although the riders that scored higher, and sometimes the normal rider scored better than the professional rider, when the riders scored higher, they could improve the quality of the horse's gaits. So the quality of the trot and the quality of the canter was improved, but the Ridden Horse Pain Ethogram scores did not significantly change. So the total scores remain pretty much the same, although sometimes the actual behaviors demonstrated altered. So, for example, with the normal rider, the horse may go with its head above the bit, but the horse didn't, so the head was in front of the vertical position more than 30 degrees for more than 10 seconds. With the professional rider, the horse now put its head behind the vertical position, more than 10 degrees for 10 seconds or more. And now the horse also started to switch its tail, which it didn't do before. So sometimes the manifestation of particular behaviors changed, but the overall scores did not change, which demonstrated to us that riders' skill cannot conceal behavioral indicators of discomfort. A better rider can make the horse move better, but they can't conceal the behavioral signs of discomfort.
That's almost comforting, because then you're not questioning if the horse is actually not in pain when they are, just because of the rider. It's good to have something that's a little bit more objective.
Yeah, yes. Now, obviously, there are things that can influence the score, which may, for example, be related to an ill-fitting saddle. An ill-fitting saddle can itself induce musculoskeletal pain. So, for example, if I'm investigating a horse and I've done some nerve blocks and I have reduced the score, say, from 15 out of 24 to 9 out of 24, I know I must be missing something. And what I may be missing is that the tree points of the saddle are too tight. So I need to change the saddle to a better fitting saddle. And then the score may go down then to 3 out of 24. So that means that I've identified the fact that we've had two concurrent problems. We've got the ill-fitting saddle plus the underlying lameness.
Right, absolutely. Awesome. Well, those, that was kind of the main bulk of the questions that I think you addressed so many of them so concisely in such a clear way that I really appreciate that. And, you kind of touched upon all the topics that I really want to talk about, unless you had any other last minute advice for owners or professionals in the horse world.
I think I would say that it's important to recognize that if you are a competitor, that the presence of discomfort will result potentially in reduced quality of performance. So, for example, we applied the Ridden Horse Pain Ethogram to horses warming up for the dressage phase at 5-star 3-day events. And horses that scored 7 or more out of 24 during the warm-up phase for dressage had higher dressage penalty scores. They were more than twice as likely not to complete the cross-country phase, which is pretty substantial. And if they did complete the cross-country phase, they finished up lower down the finish ranks. And the same has applied to low-level eventing. So horses that are jumping fences of 90 centimeters, 1 meter and 1 meter 10, we also saw a significant association between the Ridden Horse Pain Ethogram scores during the dressage phase itself and the subsequent performance. So the presence of pain is going to compromise performance. And for me, that means there's every reason to try and remove that pain, because keeping horses on the competition circuit is not cheap. So let's give the horse the best chance to do well, and for you to do well, and also for the horse to be more comfortable. So it seems to be a win-win situation for everybody.
Absolutely. Well, thank you so much for being willing to chat with me. And also, more importantly, thank you so much for doing all this research and putting the time in and really making it accessible for everybody to be able to advocate for these horses and ultimately improve their welfare, because that's what I think we're all here for. And what we really care about is the horse. So thank you so much for all your work in that.
You're very welcome. And thank you for the opportunity to spread the word. It's been a challenging thing to do. There's been quite a lot of resistance, but slowly, the ball is rolling, and more people are coming to recognize that we can improve the life of horses by the use of the Ridden Horse Pain Ethogram.
Yes, absolutely. Thank you so much. And I really appreciate your time, and I hope you have a great rest of your day.
Okay, thank you. Nice to meet you.
You too.
Bye.
I always say that I'm slightly more hoof obsessed than the average person, and chances are, if you're listening to a hoof care podcast, you are too. So we should probably be friends. Feel free to find me on Facebook or email me at thehumblehoof@gmail.com.